talking about, okay, I'm allowing the recording. Happy to see that we have a lot of people from different parts of the Caribbean region. I also noticed that we do have a couple of our students from Puerto Rico, so that I'm happy to see. In my case, I'm going to be speaking about temperature-related illness and mortality in the Caribbean context. First of all, I would like to start by saying that there are not too many research that have been done in terms of mortality or analyzing the impact of extreme weather events such as heat and public health in the Caribbean region. But we do have a couple of manuscripts. We do have evidence. So how this extreme weather events such as heat are impacting public health and excess mortality. And I'm going to be explaining, talking about a couple of them. Okay. So, okay. So the learning objectives are for you that are connected in this video, is to understand the connection about climate change, extreme heat in this case, human health and well-being, because there are some direct impacts of extreme weather events, but there are some others that are going to be indirect impacts, and those indirect impacts are the ones that are also affecting the well-being and quality of life that is very tied with public health, right? The second objective is to understand how climate change, extreme heat, and extreme heats are impacting social ecological system, because the social ecological system are the ones that we rely on and the ones that are living on, right? There is no such things as a social system and an ecological system when we're talking about urban or human settlements, right? Because we're interacting constantly with the ecological system, with the ecosystem, and with all of the different natural system that we depend on, okay? And most of it because of the ecosystem services, okay? And understand hazard, risk, and vulnerability to extreme heat in a changing climate in the context of the Caribbean region. Why I'm saying in the context of the Caribbean region, because the context is very different of many other places of the world. Most of the studies that you might see when you're searching for literature and references in terms of extreme heat and public health, most of them are based on continental cities in mid-latitude countries. But in this case, I will try it again to show you the evidence that we have for the Caribbean region. So when we're talking about climate change, I'm going to be talking about something very descriptive, short explanation about what is climate change, how it's changing in the Caribbean region, very briefly. Okay, I'm not going to be giving a webinar on climate change. But when we're talking about climate change, is that the patterns and the behavior of the meteorological and climate conditions that are changing, right, based on a 30 years period, for example. And we can use a lot of different variables, for example, precipitation, temperature, sea level rise, salinity, sea surface temperature, sea level pressure as well. So there are many different variables, but when we working with that kind of variable, we are able to identify that the patterns are moving from the belt of the normal distribution that we're seeing in the left side of the panel. It means that it's changing, and it's not only changing in the average or the medium, but it's also changing in the extreme events. And this is the most important thing and the most important context about climate change, that it's not only changing in terms of average very slowly, but also the intensity, the frequency, and the duration of the extreme weather events are changing and are being modified. And that's one of the most important things, right? What we call IDF, intensity, duration, and frequency. And in the right side of the panel, what you're seeing here is that the most to the right that we get in that picture, that is, I took it out from the Climate Central, is the more evidence that we have that those kind of extreme weather events are changing. And the most to the left that we go, it means that the less evidence that we have that these climate patterns are changing. So heat waves are becoming more intense in many parts of the world, are getting longer in duration. For instance, we might have heat wave that can last for 3 to 4 days. But now, all of a sudden, we might have heat waves that are lasting 1 week or even 2 weeks, right? which is making it worse. And also the frequency. So the frequency of the heat waves are also changing, meaning that 30 years ago, we might have, I don't know, like 1 to 3 heat waves per year, but nowadays we are suffering and facing 5 to 7 heat waves per year, meaning that the frequency of the heat waves are changing as well. So the people are getting more exposed to this kind of extreme weather events. Okay. Coming from the mid-latitudes and from continental cities, this is a study that Yale program on climate change did a couple of years ago. That is not that old, and it was proving information on how one of the most important or priorities for the American people in terms of climate change is related with extreme heat, right? So that's something that is telling you something that one of the major concerns, at least the perception, the risk perception that the American people have in mind when we're talking about climate change is extreme heat, because they are facing it, because they are suffering, because of, for whatever multiple other reasons, but it's one of the major concerns, okay? And if we look into the literature, heat waves are the #1 hazards when we're talking about climate or meteorological phenomenon that are affecting public health and mortality. So that's another important component. So the only issue is that the episode associated with heat are not considered disaster, right? So that's one of the most challenging issues when we're talking about heat waves, mortality, and public health. People are not, it's not that simple to associate this kind of hazard with mortality, right? People are used to talk about floods, hurricanes, tornadoes, and mortality. But when we talk about heat, people start to wondering how can that happen, right? How is that happening? What are the interaction, the pathways for that to happen? But when we look at the database that is provided by the National Weather Service, and I will show a couple of other examples. When we're seeing in the left side of the panel is the different climate hazards that are impacting public health, and it's costing billions of dollars for the American taxpayers in the United States, right? So what we're seeing is that when we're talking about the economical impact, hurricanes are ranking #1. They're first, right? As we are seeing, based on the data that I'm showing here, between 2004 and 2013, hurricane costs over almost $400 billion in the United States in preparedness, response, adaptation, right? And impacts, right? But when we're looking about mortality, heat waves are ranking #1, right? Based on the 10 years data, we're seeing that heat waves is the #1 hazard in the United States when we're talking about climate change, when we're talking about climate hazards and weather phenomenon interacting with socio-ecological systems, okay? So one of the most challenging things is that, as I mentioned, heat is a silent killer. It's considered a silent killer. It's not fancy for the media to take a picture for heat. It's not something that you can see as the hurricane moving, or the track of the hurricane, for example, or getting stronger and bigger, and all those kind of things that the media love to put on their webpage and their journal. So it's difficult to work with heat when you're trying to, right, to communicate as a hazard. It's not that simple, okay? But again, if you take a look on weather fatalities, no matter what kind of information you're using, if you're following the CDC, you're following the National Weather Service, if you're using whatever kind of information from the federal agency that you're using in the United States, you may see from the right to the left, that weather fatalities associated with heat ranked #1 in 2017. In 2018, I was unable to find, I don't know why, 2019, but then once again, in 2020, weather fatalities associated with heat ranked #1, okay? So there is no discussion about that when we're talking about climate change, extreme weather events, and mortality. Heat is the silent killer that we need to pay attention to, okay? So what is happening in the Caribbean and why heat is so important for us, even though that we can say that in the Caribbean region we are living well, in a warm weather, in a tropical environment, in a hot and humid environment. But that doesn't mean that we have the adaptive capacity to survive these new scenarios that we're facing now. Okay, and it's associated with many social determinants of health, with landscape transformation, modifications, and institutional context that we have in each of the different islands and territories. Okay, so what is happening? So based on the most recent climate change report that the IPCC released a couple of months ago, on September and August 2021, there is a lot of evidence that is proving that climate change continue. The planet Earth is getting warmer at a precedent level faster than it was established before. That's another problem. And also that the northern hemisphere is getting warmer faster than the southern hemisphere. Okay, and this information is available in the new IPCC report, and you will see it also in the right side of the panel on another report that it was released for the 2020, which is the assessment for the climate assessment for the Caribbean region and Latin America. Okay, from the World Meteorological Organization. Okay, so why this is happening very quickly? So burning fossil fuels, we are doing more emission of greenhouse gases, such as CO2 and some others. And because of that modification in the atmosphere, we are now capturing and retaining more heat inside of our atmosphere than we are able to release, right? So that means that we're absorbing and we're capturing the heat that we are receiving from the sun. And that is the main cause for warming in Earth, okay? So if we look at the data, Climate Central, we scientists were not the best one on showing infographics or graphics or data. So I'm always using Climate Central, not always, but in most of the cases, I'm using Climate Central because I love this kind of graphic that they do. They are very smart, simplifying the information and the data that we would like to provide for citizens, stakeholders, and practitioners. But in this case, so you will see it simple and it's pretty easy to understand. So what we're seeing here in the top side of the panel is that showing two graphics. In the left side, we are seeing the trends over the past almost 200 years, since 1880s until the 2020, right? And we're seeing an increasing trend when we're talking about global temperature, right? And in the right side, which is worse, is that all of the most recent years, we are establishing new records on heat for planet Earth, meaning that it happens in 2005, but then in 2006, and then in 2005, 15, and so on, so on. All of the years, the recent years, all of them are establishing new records for heat. So for most of the other extreme weather events associated with climate change, there is no particular trend. The only ones that are pretty clear are increasing in Earth surface temperature and increasing in sea level, okay, in mean sea level. Both of them are pretty clear that there is no way back, okay? And both of them are associated with the warming environment that we are creating with burning fossil fuels, okay? In the lower side of the panel, what we're seeing is the CO2 level that are being analyzed thousands of years ago by scientists in NASA and NOAA, and where we are at the current level in the 2021, right? So we are marking another record for CO2, meaning that the situation is getting worse in terms of CO2 in the atmosphere, okay? Where all of this heat is getting captured when we're talking about the planet Earth. So most of the heat that is getting captured by the atmosphere is not only captured at the soil, at the surface, but it's also captured at the ocean. And it's being released very slowly because the water column have more capacity of absorb the heat. And when you're going down with death, okay? So most of the heat that the Earth is capturing is being stored in the ocean, which is then associated with more extreme weather events. Okay, so for the Caribbean, what is happening with we saw that the global temperatures are rising, but for the Caribbean as well, right? I think that I mentioned this before. The northern hemisphere is getting warmer faster than the southern hemisphere. Let me go back very quickly. And why is so? This is one of the reasons why I had this slide. Why is the northern hemisphere getting warmer than faster than the southern hemisphere? It's because we have more land surface area. We have most of the industrialized countries that are emitting air pollution and CO2 to the atmosphere, burning fossil fuels. Most of them are in the northern hemisphere, and we have more territories and we have more people living there, right? More population. In the southern hemisphere, if we cut planet Earth through the equator, you will see that there is not too many land masses in that area, right? All of the Euro-Asia, Asia, Europe, North America, all of the big continents are in the northern hemisphere, and also the Caribbean region. So we in the Caribbean are placed in the northern hemisphere, right? So we are in one of the hemisphere that is getting warmer the faster in the globe, okay? So in 2018, in the United States, they did the National Climate Assessment, and the National Climate Assessment is one of the most important assessment that is being done in the United States after the IPCC. So, and it's being updated every 4 years, and it's being updated right now as we speak, and it's going to be released in 2023. So the most recent version is the one in 2018. And this one is showing that actually the Caribbean region is also getting warmer, and as not only because of the trends and the historical data that we have on temperature, but also the projections that are based on the emissions that the other countries are doing, right? So when we're talking about the higher scenario, it means the worst case scenario, right? So if we continue doing business as usual, burning fossil fuels and with higher emissions, it means that our temperatures are going to be higher than normal and 8 degrees Fahrenheit or above. And when we're talking about lower scenario, it means that if country takes it, the countries that are the most important in terms of reducing the emissions, if they do that, that means that we might be able to mitigate the speed of the increase in temperature, right? So that's the lower scenario. And that means that, but even though the countries might be able to reduce the emission, the temperature will continue to increase, impacting not only public health, but all of the living organisms that we depend on in the Caribbean region, okay? And also water resources. So as I mentioned, the northern hemisphere is getting warmer faster, but not only we are in the Caribbean region in the northern hemisphere, but we are in a tropical environment. And what happened? That the CO2 is one of the main greenhouse gases, but anthropogenic, right? But one of the most important greenhouse gases that is natural is water vapor, right? And water vapor, it comes by evapotranspiration, and water evaporation from the oceans and water reservoirs on the surface area, right? And in continental areas like lakes, reservoirs, or all other wetlands, or whatever other water bodies that might be able to transfer water to the atmosphere, right? So NASA released this new in 2018, back in 2018. So if the northern hemisphere is the place, that's ranked #1 in terms of increasing temperature, the Caribbean region is in the northern hemisphere, but then we are in a tropical region. And what happened is that in the tropical region, NASA is suggesting that there is a super greenhouse effect for the Earth's tropic that is associated because sea surface temperatures are also increasing, meaning that the water is being transferred to the atmosphere, providing more water vapor to the atmosphere. And this natural greenhouse gas represent almost 80% of the greenhouse gases and in the atmosphere. One of the best things of this greenhouse gas is that it's natural, right? And it's a short-term gas. It don't last like the CO2 that it can last 50 to 100 to million to 1,000 of years. But in this case, it's have a short period of time in the atmosphere. But still, it is representing a problem for us that are living in tropical region. So another important issue, because the heat that we're facing in our region is completely different. It's warm and humid, right? So it's not the heat that other places in continental areas are facing. So that's a particularity and a uniqueness that tropical region have, and it's even worse in tropical islands, right? Because there are other tropical regions in continental parts, right? So in 2020, then this manuscript came out, and it was published in Science. Science is one of the best journal for peer-reviewed journal that exists, that providing this a lot of different scientific manuscripts, right? And in 2020, these authors were able to show evidence that indeed heat, earth surface temperature, and humidity are being too severe for human tolerance. So something that, okay, IPCC is telling us that the temperatures are increasing in the northern hemisphere faster, but then NASA is telling us, hey, be aware that the tropical regions are one of the most vulnerable sites worldwide when we're talking about heat, because there is a lot of water vapor available, right? And heat and humidity, then you have an increase in heat index. And heat index is the sensation of heat that your body is feeling, right? So it doesn't matter if the wet bulb is saying that, or not the wet bulb, sorry, if the thermometer is telling that the temperature is like 28 to 29 degrees Celsius. But if you add to that 70 to 80% of humidity, relative humidity, I can assure you that the heat index will increase significantly, right? And I will be explaining later why that is so important. Okay, that manuscript is also available, and I think that I share it with most of you. What kind of evidence do we have? I already showed that for the United States, as an example, as a proxy, the heat is the #1 hazard in terms of mortality and climate change. And for the first time ever, we were able to at least analyze mortality in the context of extreme temperature in Puerto Rico. And what we found is that actually higher frequency, as I mentioned at the beginning, the IDF, right? The frequency of the extreme event, the duration of the extreme event, and the intensity of the extreme event. So what we saw is that in Puerto Rico, the relative risk for cardiovascular diseases, mortality, diabetes, hypertension, increases significantly when air surface temperature are above or at 89 degrees Fahrenheit, right? So, and this was a manuscript that we did a couple of years ago in 2016, 2017. It was published in the International Journal of Biometeorology. And this is the first proxy. We're not talking about that we were able to measure mortality. It's a relative risk. We were not analyzing excess mortality. But again, it's a proxy. We're still working on it, and we're continue working on fine-tuning of the analysis that we did back in 2016 and 2017, right? So there is evidence that what is happening in Puerto Rico as a proxy in urban areas. I will explain more in a few minutes. So for the first time ever, as most of you have heard if you follow the political issues internationally, the last administration in the United States were not a believer on climate change. And I don't like to use that kind of word and language, because this is not a religion. We're not talking about believer or not believer. This is science, right? And this is evidence-based. So, but the last administration, they think that climate change was a hoax, right? But what happened is that when the administration changed and Joe Biden took the White House, the first thing that he did was that he resigned the United States of America to the Paris Agreement on climate change, right? So, and then a couple of months ago, for the first time ever, the Biden administration, I think, is one of the first administration in the United States recognizing that extreme heat is the #1 killer when we're talking about climate change. So for the first time, he did like an executive order asking for 13 different federal agencies to finally work on protect workers and community from extreme heat. Remember that extreme heat is not considered a disaster. How so? I truly don't understand, because if extreme heat is all of the evidence is suggesting that extreme heat is the #1 in terms of mortality, then why we don't have a program to recognize extreme heat as a disaster to protect our population, right? That doesn't exist. So for the first time, we're moving in the right direction, at least from the United States and the territories that are part of it, okay? So how these extreme events are interacting with the social and environmental conditions. Well, in the same report that I mentioned before in the National Climate Assessment, there is a full chapter that is talking about human health and climate change. And as I mentioned, you have direct impacts that it can be, for example, a flood or a hurricane, that your house get destroyed and that your house collapse and all of the debris fall on top of you, and bad luck, you get hit and you die, right? That's a direct impact of a weather phenomenon. But some others are more indirect, right? So you have the climate driver, for example, that is the extreme heat. And this is interacting with the institutional context. How well prepared are our territories, our islands, our countries to deal with these extreme events? Do we have policies in place? Do we have a framework how to work it for resilience, for preparedness, to respond for this extreme weather? Do we have the infrastructure conditions to deal with it? Do we have, for example, when we are facing, at least in Puerto Rico, it happened, when we are facing extreme heat events in Puerto Rico, energy demands increase so much that in some cases, the infrastructure for energy is so dire in our island after Hurricane Maria that the system collapsed. It doesn't have the capacity to satisfy the demand on energy when we are facing extreme heat conditions in Puerto Rico. And that's a reality because everybody's searching to cool the indoors environment, right? Even with a fan or air conditioning or however you can, right? So the institutional context is very important to interact with these extreme events. And then in the right side, or also how do you modify the ecosystem and the landscape, right? And that can exacerbate the conditions. For example, if you promote high density urban areas, as it happened in multiple cities, then you might be enhancing also or promoting urban heat islands, right? That means that the situation is even getting worse. And I will show a couple of cases for Puerto Rico. And in the right side, what we have is the social determinants of health, right? So age is a social determinant. It's not the same thing that you are 20 years old, healthy, in good condition, well nutrition, and you're facing an extreme heat event that if you are elderly, you are in bed, or you have a disability, right? That's another story. That's another way on how to face this extreme event. Poverty is another social determinant because what happens with extreme heat is that if you're living in low income communities, you might be able to at least buy one air conditioner. But if you have an extreme event, as it happened in Puerto Rico in 2012 and 2013, that it lasts for 40 days, you might not be able to turn on the air conditioner for 40 consecutive days because you might not have the budget to pay for electricity bill, right? So poverty is a determinant when we're talking about heat. Not everybody have the same conditions to face the extreme heat conditions. While if you're living in high income communities, they might be able to buy a big air conditioner or a central air conditioner and keep it the air conditioning on while it lasts the extreme heat. If it lasts for 1 month, they might be able to turn it on for 1 month and pay the electricity bill, right? So it's a lot, there is a lot of different. If you have pre-existing health conditions, if you are suffering for heart diseases, cardiovascular diseases, diabetes, cancer, we found out that cancer patients suffer more heat episode because of the chemotherapy. And we found out, at least in my case, I linked that information after the hurricane in Puerto Rico, and I will show you also a couple of examples. So it's not the same thing again if you are young, 25 to 24 years old, healthy, with good nutrition, living in high-income community with access to infrastructure, that if you are elderly, 75 to 80 years old, with pre-existing health conditions, or some medications or treatment that are changing your organism, right? So it's complicated, right? And all of these contexts are modifying your adaptive capacity, your sensitivity, even the exposure, right? And your capacity to cope. Your capacity to cope will be determined somehow by all of this context, the institutional context, and also the social and behavioral context. And in the right side is the component, the changing of a scale. In the left side, we're talking about the state, the island, the territory, and the communities, right? The social component. But then in the right side, we're talking about the individual and what are the other conditions that can exacerbate the situation, right? Some of them are associated with your community, for example, all of the social component, but some others are associated more with your lifestyle, the physical activity. If you are overweight, if you have obesity, right? Your sleep behavior, heat is associated with a sleep disorder. If you don't have the capacity to mitigate the heat, it's also associated with a sleep behavior. Diet, if you have a diet or nutrition behavior that is rich in fat, that's also another issue to consider. Drug use, smoking, alcohol use, and some other things that are tied to your lifestyle, right, are interacting also with the heat conditions. And in the other side, obviously, you have the physical chemical components, meaning that you might be also exposed to some other hazards that are interacting because of your where you work or where you live. For example, if you're a farmer, you might be exposed not only to extreme heat, but also to pesticide, right? So you might have a combination of both. If you are a builder, if you work on construction, you might be exposed also to heat more than people that are working on services in indoors environments, in supermarkets and pharmacies, or even academics, for example, as well, right? Okay, I don't know. Okay, this is block, I think, here. Let me see if I can move this a little bit. So this is only an infographic that is showing the different other way on how to see the different pathways of exposure, right? And the factors that are getting us more vulnerable, if we want, as I mentioned before, adaptive capacity, sensitivity, exposure, and capacity to cope, okay? The demographic factor that I mentioned before, the geographic factors, if you're living nearby green infrastructure or forest area, or if you're living in urban environments, that again, I will show a couple of examples, okay? And so on. But this information, you have it available in the presentation, okay? What are considered a population at risk? By children, kids below 5 years old. These are one of the most vulnerable population that could be affected by heat, right? But obviously, it's one of the population that all of our society protect the most, right? Elderly, the second in the list, right here. Again, another population that most of our society take care of, but also are one of the most vulnerable population to extreme heat. Pregnant women as well, right? Farmers, then you will have occupational exposure, not necessarily because you're an elderly or a kid or a pregnant woman, but also because where you work, you get more exposure to extreme heat than in some other places, right? So you're working in an office, as I mentioned, as a lawyer, or in services, or in a supermarket, it's gonna be different, or in a hospital, right? If you're a builder, right? So that's another thing that we need to consider when we're talking about heat. Okay, so a couple of case studies that we have for Puerto Rico and the Caribbean. In After Hurricane Maria, we create a couple of brigades for public health brigades that we impacted British Virgin Islands, U.S. Virgin Islands, providing material for constructions, providing professionals, providing supplies, water, and a lot of other things, right? Physicians, medical doctors, nurses, and a lot of all of the services that we were able to provide throughout the university, and a lot of alliance that we did with many NGOs and private sector from Puerto Rico, the United States, and even internationally. Okay, so we were blessed on that part. So right after the first 5 to 6 months after we did the public health brigades, again in a couple of islands in the Caribbean, then we were able to submit a proposal, a research proposal to the National Cancer Institute with what we learned working with the communities and trying to help the people that suffered the most with the hurricane. We submit a proposal working with trying to identify what were the impact, the most related impact and environmental conditions that women that were identified as one of the most impacted persons in Puerto Rico with the hurricane, females living alone with cancer, right? Cancer, as I mentioned, is a pre-existing health condition that obviously when you're facing this kind of disaster might be a worse situation for you, okay? And we obtained a grant from the National Cancer Institute. We were wondering what were also the environmental conditions that the people face in the aftermath of Hurricane Maria that were not necessarily associated with the direct impact of the hurricane, but during the aftermath, right? For example, the lack of electricity, the lack of potable water, water sanitation, electricity that you needed for your treatment to keep your medicines cool, to maintain a minimum hygiene for your food, right? In your fridge. But if you don't have electricity, then you will not have the minimum requirement for hygiene, right? So one of the things that we observe, right, in the right side of the panel that you're seeing here is that only a couple of days Hurricane Maria passed over Puerto Rico, crossed Puerto Rico, or hit the island on September 20th. And then already in a couple of 6 days after the hurricane, there was a journal that was already identifying heat as one of the most important issues for the people, right? In the aftermath of Hurricane Maria. And why was that? This is very important, right? Heat, but interacting with misery, right? And shortage for months of electricity. Without power, you might be unable to mitigate the heat that you're facing, right? Okay, so we did a focus group with cancer patients. We did interviews with medical doctors, oncologists, or island-wide, right? It was a qualitative research, but then we confirmed this information with quantitative data. So the bigger the word, it means that more important or priority was to women that were suffering in the aftermath of Hurricane Maria, and that they had a cancer and they had an ongoing treatment or for whatever reason. I'm not going to be telling all of the details, right? But we're seeing house. The house is your sanctuary, right? It's the most important thing. So apparently for all of the women's house, their housing, it was the most important thing for them during the hurricane. Water is essential for life, right? But then all of a sudden, which one is the almost, I think, the third biggest word that we can see with the same size as hurricane? This is a word cloud that you're doing with a statistic, right? This is only a fancy way on how to show it, not only numbers. So we're seeing that heat is as big as hurricane. So for these women, apparently the extreme heat that we face after Hurricane Maria was so important as the hurricane. That's an important finding, right? We were able to publish and to this research in a journal, and I think that I provide also the manuscript to the organizing committee of this course. So After that, what we did is that, wow, this is amazing. It means that, and it makes a lot of sense, and I will explain now a little bit more about that. So why it makes a lot of sense. Um, so we found that speaking with the physicians, with oncologists, and with the women that were with cancer, with gynecological cancer in the aftermath of Hurricane Maria, that for them, the extreme heat was so important as the hurricane. This is wow. Okay. So how do we explain this? Okay. Number one is because, as I mentioned, cancer patients, you might know this, that are under treatment with chemotherapy, they might suffer more hot flashes than normal people. So that is an increase in your sensitivity, right? Then hurricanes provide a lot of water, floods, water everywhere, everywhere. There were places in Puerto Rico that stayed underwater for 14 days. You can imagine. But we're still in the tropical area, and we're talking about September 20th. So we are right in the middle of the equinox, right? When the sun is right in the middle of the equator in a tropical area. You can imagine. So there were a lot of water available in the surface area. So evaporating from the surface to the atmosphere. And what I mentioned about NASA is that the tropical regions, we had a supreme greenhouse effect, natural, which is water vapor, that is increasing the heat index, right? That's number one. Number three, number one is that hot flashes, sensitivity. Number two, that there were a lot of water available and a lot of sunlight in the tropical area. So that water from the surface became as a water vapor and humidity in the atmosphere, increasing heat index. And the third one is that I've seen is that all of the green infrastructure, the ecosystem service that can regulate and mitigate the temperature, such as the forest, such as the at parks, green infrastructure, vegetation, they were destroyed by the hurricane. So we lost all of the possibilities to control and mitigate this extreme heat because we lost electricity. There were no way to get your air conditioning. There was a lot of heat index increasing. There was a lot of, without green infrastructure, a shadow where to stay under the sun, under the trees or the vegetation, right? So we lost all of the green infrastructure. And as you can see in the right side of the panel, this is how temperature behaved right after the hurricane. So zero is mean that the day that the hurricane were getting close to Puerto Rico, impacting, you might see how the temperature decreased significantly, right? And then all of a sudden, the temperatures were 10 degrees below normal for almost 7 days after the hurricane. That's a huge, huge heat wave without electricity, without air conditioning, right? And in Puerto Rico, we suffer excess mortality that is partially attributable to the hurricane. And there are many research that are being done for that. Another component is the urban environment, right? So what we found is that obviously landscape transformation promote urban highlights by promoting more concrete roads, residential units, buildings, shopping centers, industrial areas. You are promoting the retaining heat in these environments that is getting hotter than the surrounding areas, right? With forests. This is the city of San Juan. These are the boundaries of the city of San Juan as a proxy. And as we are seeing here, red colors meaning the areas that are hottest in the cities, and the blue colors are the ones that are cooler in the cities, right? For example, in this area, what we're seeing is a red dot that is a big shopping center. But with this map, what we did is that we work for vulnerability maps in terms of heat, trying to identify the characteristic and the profile of the population that are living and exposed in one of the warmest areas of the cities. Why we did that? Because if we are to face another extreme heat event, we might be able to issue some advisories and warnings with very specific target populations and geographic areas. So now we know where are the places that are hottest in the city to advise and to issue specific warnings for the population to take precautionary measures. Okay. People that are living in high density urban areas, people that are living alone, people that are living below poverty level, people that are living without health insurance, people that are lacking of a high school diploma are one of the most vulnerable to heat in Puerto Rico. And also, we were able to identify that blue infrastructure and green infrastructure are essential to mitigate these heat episodes, as we're seeing here. For example, these are part of San Juan. In the blue colors, we're seeing one of the biggest lagoons that we have in the middle of the city. And that lagoon is changing or modifying temperature by almost 25 degrees difference from the surrounding areas that are the airport, the main airport, for example, that land surface temperature can reach up to 60 degrees Celsius. That's very hot. So you can imagine someone that is working in the airport, I don't know, giving maintenance to the airplanes or working there. It's a very hot environment, right? But we are proving evidence to the government and stakeholders and practitioners and citizens that actually green infrastructures have the capacity and blue infrastructure have the capacity to help us mitigate this kind of extreme events, right? In the lower side, what we are here is the botanical garden. The botanical garden is like the lung in San Juan, in Puerto Rico. It's one of the biggest green areas that we have, surrounded by high density urban areas. High density urban areas are red and can reach up to 50 degrees land surface temperature. Land surface temperature is the temperature that you can touch on the ground, right? But it's very important. So this is a lot of evidence on how ecosystems are providing benefits, helping to mitigate this kind of extreme event. So ecosystem services are very important. It's a way on how to value, not using a market value, but a non-market value on how this ecosystem can provide us benefits. For example, there are 4 big categories. Ecosystem services, terrestrial or marine or ocean, they can provide provision, for example. So in the case of green infrastructure, they can provide wood, material constructions. They can cool the temperatures. They can purify the water. They can also clean the air, right? This is one of the essential services that we can receive from the ecosystem, right? And these are called ecosystem services. It is well understand that, for example, in the case of urban forest, it can help you in increasing the property value. In some cases of the United States, it's working like that. It helping with improving air quality as well. Energy saving, because with the shadow that you are receiving from the leaf and from the canopy of the vegetation, you are reducing the sunlight that you are receiving in your house, meaning that you might be able also to reduce indoor temperatures, and you might also reduce energy consumption because you might not need so much cooling in your house or your apartment. Okay, this information is available with all of the research that we have done, proving that actually in Puerto Rico, indeed, people are dying because of heat. We found and we were able to publish that in a research journal that excess mortality, not excess, relative risk increases when extreme heat arrives to Puerto Rico. We were able to prove that in collaboration with the National Weather Service and the Department of Health, right? We didn't do that only alone at the academia. We work in collaboration and in alliance with the National Weather Service, which is the responsible agency of monitoring the weather conditions to issue warnings to protect public life, right? So we started working in 2012, 2000, and we finished a couple of manuscripts, as you saw, in analyzing the heat vulnerability, analyzing the heat mortality, and the extreme heat event that happened in Puerto Rico, and also with urban heat islands. So with that information, we were able to finally transfer this information into an action, right? Not only as academia, publishing manuscript, but also impacting decision makers and implementing actions that might help mitigating the impact on public health, right? So what we did is that in collaboration, we developed the first warning system for heat in Puerto Rico that it started in 2018. Nowadays, Puerto Rico has this kind of tool that is available for everybody, for all of the people living here, to see and to understand the level of risk and the threat that they're facing because of heat, right? And please note that we are not using Earth surface temperature. We're using heat index because, as the other manuscript mentioned, and as I mentioned before, the heat index is very important for your thermal comfort, because the more humidity in the atmosphere is more difficult for you, for your skin to reduce the temperature of your body, because the way on how your body try to regulate the temperature is by sweating. But if there is a lot of humidity in the atmosphere, it's not by only sweating that your body gets cooled, it's by the evaporation of the sweat, right? So if that sweat doesn't get evaporated from your skin, you're still accumulating heat in your body, right? And it's associated with the amount of humidity in the atmosphere. The most humidity in the atmosphere, the more difficult it is for our body and for our organism to thermoregulate the conditions, okay? So that's one of the reasons why in our case, we're using heat index. It's a uniqueness for our region. It's a uniqueness for our local regions. It's not like, for example, in Arizona, that you are measuring air surface temperature, or you're telling that in numbers, not considering necessarily the relative humidity. In our case, we did it like that, okay? So then there is a lot of infographics that the National Weather Service is providing. For example, this is a pretty good example that I would like to show here. In September 28, 2021, as you can see, we reached in some places temperature above 110 degrees in most of the places of Puerto Rico. And when you're seeing at the chart in the left side, those are dangerous conditions for human health, okay? It's considered by the CDC, the National Weather Service, and the Puerto Rico Department of Health as well. So it's very important, right? But now we have this in place. It's working. What happened in September 28, which is worse, is that Puerto Rico suffered a huge blackout that, for those of you that are connected from Puerto Rico, you might remember. And it lasted for almost 1 week. Out of nothing, all of this electric system collapsed. And what happened is that during that week, we were facing one of the worst extreme heat events occurring in September, increasing the energy demand, and the system was completely unable to satisfy the demand that received. And it collapsed. But it not only collapsed, it collapsed and it lasted for 1 week completely. And during those days, the government of Puerto Rico declared an energy emergency. So you can imagine the disaster that it occurred and in Puerto Rico because of that as well, right? We're energy dependent, right? That's another important thing. These are some of the infographic that the National Weather Service is issuing, but also we are continue working with the National Weather Service and the Puerto Rico Department of Health in doing outreach activities, webinars, educational materials to let the people know that this is real, right? It's a different hazard that we might not be aware because we live in a hot, warm environment in the Caribbean, but it's one of the most important one when we're talking about your health and mortality. And it needs to be talk about it. We need to talk about this seriously and to people to understand, to take precautionary measures. So that was my last slide. I added a couple of references for you guys that are interested in the topic. You might find more information of the things that I try to discuss during this evening. I think that I will stop here and I will open the, I don't know, well, it's not to me to open it, but I will allow the coordinators or the moderators to help me with the Q&A section.
Thank you very much, Pablo. That was a real eye opener. You told us heat is a killer. You told us that a wet bulb temperature is what we need to pay more attention to, not just the number, and that the Caribbean and the Northern Hemisphere is at greater risk. The tropics are at high risk, and the need to warn people, the need, I would say, to get health professionals more aware of this in the training programs that we have in the Caribbean, and that some people are very vulnerable. One of the very vulnerable groups in the Caribbean is sports people, and of all the field sports, actually cricket, which you don't play so much in Puerto Rico, is the most vulnerable field sport because people are in the sun all day long. And there have been a number of notable instances where very eminent players have collapsed in the last couple of years in Australia, in Pakistan, and they've changed the time of matches because of the heat. So thank you for that. You also pointed out something, we talk about the 1.5 degrees and we think of air temperature, but most of the heat is stored in the ocean. And that means the oceans are more able to power the superstorms that we're seeing, more frequent storms, more big storms like Dorian, double hurricanes, triple hurricanes at the same time, longer lasting hurricanes, as Dr. William Hamilton was telling us during the lecture on hurricanes. So the heat has a lot of implications for lives and for livelihoods and for health, with some very vulnerable groups that need special attention. So thank you very much. I'm gonna start passing you some of the questions now. Let's see. Here we go. So the first question has to do with, are there any Caribbean institutions that you're aware of which records heat stroke as a cause of death?
Can you repeat that question, please, James?
Are there any Caribbean institutions or institutions in the Caribbean that are recording heat stroke as a cause of death?
Thank you. That's an amazing question. Thank you for asking that. It's subreported in the Caribbean, right? We still don't know why. We're wondering, we're having meetings, focus groups, and interviews with physicians and medical doctors, at least in Puerto Rico. But in our opinion, it's something that is still subreported, probably because of the formation of our medical doctors, probably because of the education that receiving. But now, there are not too many heat stroke or associated with mortalities in our region. So again, you might need to search for others ICD codes, for example, or other cause for mortality that you might find in the literature that are more sensitive to die, right? You might start by doing that, by exploring in your country, in your island, what are the main specific cause of death, right? That could be associated with extreme heat. Again, I will suggest to start looking by cardiovascular diseases, diabetes, cancer patients, non-communicable diseases, obesity, hypertension. Those are the usual suspects.
Thank you for that. I think in all our countries, it's a medical doctor that is responsible for certifying death and then writing the causes of death. And I think certainly I can speak for myself. When I trained, there was little appreciation of heat as a cause of death. So I think we have work to do on, as you mentioned, improving the skills and the knowledge of health professionals and doctors on heat. Those Ministry of Health or Department of Health records then go to institutions like CARFA, the Caribbean Public Health Agency, and to OPS, the Oficina Panamericana de Salud, Pan American Health Organization. And that's an institution responsible for recording this, but they can only do that if the physician is certifying cause of death. So another question from Kenneth Niles, Pablo. How are heat waves impacting rainfall in the Caribbean and winter in the temperate or continental countries? How are heat waves affecting rainfall in the Caribbean and winter in temperate or continental countries?
Yeah, another good question. The Caribbean is expected to get drier, or rainfall is expected to decrease by 20 to 25% in the next couple of years and decades up to 2060. Those are the new scenarios that were published by the IPCC, right? But when we're talking about the Caribbean, please keep under consideration that all of these global models are not considering specifically what is happening in island territories, right? So island territories are not noticeable for this kind of models, right? So meaning that it can be even worse when we're talking about that. When we're talking about increasing in heat, we might be also talking about increasing in evapotranspiration. I'm talking about also in the islands or territories in the Caribbean, in the Central America that might have reservoirs. It means that also more evaporation is occurring, right? Because it's increasing also the temperature in the surface of the water. So you might be also losing more water than expected, not only because of the reduction in the water system and in the water entering the system by the rainfall deficit, but also by the water that is being transferred from the available water that is being transferred from the surface area to the atmosphere with evapotranspiration.
Thank you, Pablo. So next question is from Christopher Singh, and it has to do with heat and diabetes. Temperature changes can trigger a person's susceptibility to develop diabetes, as well as impose adverse effects on those diagnosed with diabetes. You mentioned some: hospitalization, dehydration, and death. We have data to suggest that the Caribbean islands, facing risk of drought for long periods, have a higher incidence of diabetes?
Well, in the case of Puerto Rico, the incidence of diabetes, the diabetes and the prevalence is more associated with nutrition facts and lifestyles, right? So then, as I mentioned before, there are some things to consider that are interacting with the climate extreme events. So in our case, there is a higher prevalence of diabetes, higher rates in the island. And when you're this extreme heat, these patients might require more hydration, as James mentioned before, right? So it's the clinical component. I'm not a medical doctor, sorry for that. But the statistical analysis is suggesting that these patients are suffering one of the most because of these conditions, because of extreme heat. Why so? In some cases, the literature is suggesting that these patients might require more hydration than others when they're doing treatment, right? So, yeah.
Thanks for that. I think often people who have diabetes have coexisting hypertension. They may be on diuretics, so that also increases the risk. Question from Arthur Pierre. Is there evidence on data on skin cancer related to increased heat or direct sunlight?
Well, at least for what I have done, no, I don't have evidence to provide that. It sounds interesting, obviously, and it makes a lot of sense to start thinking and believing that that's another thing to explore in our territories. But I don't have evidence to show you on that regard in Puerto Rico or on other islands that I've been working on. But
Okay.
that's an interesting thing because it makes a lot of sense, obviously, absolutely.
From Kenneth Niles again, how were persons in Puerto Rico able to observe the COVID-19 protocols when you had high heat indices?
Can you repeat that again, sorry?
How were people in Puerto Rico able to observe or obey the protocols for COVID-19 pandemic with the heat index?
That's a pretty good question also. I don't have a specific information to suggest what happened with the people that stayed because Puerto Rico declared a lockdown, as in many other places, right? Meaning that if one of the strategies for you to search for a place, a cool environment where to mitigate the heat, but then all of a sudden you were unable to do that, right? Because the shopping center were closed, you were not allowed to get out of your house and those kind of things. we might think, we can expect that people suffer more with low-income communities during the summertime and in Puerto Rico when they were in a lockdown than they when were not in a lockdown. Okay, that could be expected. We don't have that information. Actually, we are analyzing that and we are trying to understand mortality that occurred during the 2020 that were not necessarily associated with COVID, because we did suffer a couple of extreme heat events that we would like to understand what happened as well. So that's another opportunity, research opportunity.
Thank you. I think there are a lot of research opportunities to answer some of the questions of the impact of heat in our region. And here's an interesting question that you may wish to have a go. Is there anything that can be done to utilize the heat stored in the ocean for energy or for positive use? A question from Andrea Roach Estwick.
Yes, absolutely. It can be used. There are different ways on how to extract energy from the ocean. Geothermal is one of them. The other ones are from the waves, currents, tides. So yes, there are many ways on how we can extract energy from the ocean. Again, geothermal is one of them. Ocean thermal is one of them. Sorry, no geothermal. Ocean thermal is one of them, and it can be done. There are some researchers in Puerto Rico that are analyzing these gradients in the ocean nearby the island to explore those kind of opportunities to see if it is feasible for Puerto Rico to start working on that. But absolutely, need to be considered.
Thank you. Have you seen a correlation with increased temperature and skin rashes or diseases as a presentation of the sustained change in climate?
Yes, having seen that, I have a graduate student that is doing his PhD in analyzing dermatological conditions, yes, with environmental conditions. So he's still working on his research proposal, but the literature is suggesting that actually, yes, by sweating, for example, if you're living again in a low-income community, you don't have ventilation, you don't have air conditioning, you don't have no way on how to cool your indoor environment, and if you are in bed because you have a disability that you cannot move, then you might suffer a lot of ulceras, right? I don't know if you use that word in English, but when you have skin rashes that occur, the people that are lying on bed and they're sweating and they are unable to move from one side to another. So yes, it happened. We have evidence, visual evidence, qualitative information that happened after Hurricane Maria in Puerto Rico, with a lot of people that were unable to move, for example, and in their beds.
Thank you. Yeah, I think you can well see the plausibility of that discussion. From Dr. Shamdev Prasad, concerned about the elderly and heat stress, especially with the record daytime temperatures. Do you have any suggestions as to what we can advise these vulnerable patients to do to reduce the effect of the heat?
Yeah, well, reduce exposure. These are not specifically, they're not, most of them are exposed because of their labor. Most of them are retired, but reducing exposure, keep hydrated, right? Stay in cool environments, avoid sunlight exposure again, those kind of things.
Okay. Okay. Are you using any heat reflective paint in Puerto Rico to put on the roof of the house to reflect the heat?
No, and that's amazing because I saw research that they are creating like a super white color, right? That is created because of that, to reflect all of the energy that you are receiving. But let me tell you something, this is not new. That's a pretty good question, but I don't know how many of you are aware of los pueblos blancos in Andalusia. This is in Spain, the southern part of Spain. I will put it in the chat. And you will see that they are called the white towns. It's in the southern part of Spain. And as if you're seeing in Greece, for example, all these areas are painted in white. And I used to live for a couple of years in Europe. And this town explained to me 20 years ago that they traditionally paint all of their houses in white to avoid heat indoors of their environment, of their buildings, right, and housing. So yes, that's not something. First of all, it's not new, and second, it's something that it can be done and is being done in some other places of the world. Okay, it's interesting on how can we use by using colors minimize the impact of heat.
Thank you, Pablo. Dr. Henry, you have your hand up.
Yeah, I was saying in Haiti, where we don't have much electricity because of the grid. What we have been doing in Haiti, we have been using a lot of the way we have ventilation bricks, right, to get the air in and air out, and also how we structure the buildings to use the trade winds. So we have natural ventilation in terms of how we structure the buildings, and also the use of ventilation bricks. In Trinidad and Tobago, we have found that we have changed the structure of houses because we are now using a lot of air condition. So we don't have that ventilation that we used to have. See, like when I was growing up as a child, so a lot of concrete. So I think this heat reflective paint is also a good addition to the mix. Oh, don't forget to fill out your CMEs in the chat.
Yeah, that's a reminder to fill in your CMEs within 2 hours of the close of the program. Moving right along to some of the other questions. What about the rise in temperature? How will that affect mosquitoes, Pablo?
Wow, another good question. It's not necessarily related with mortality, but yes, it's related with mosquito. What we have seen with the mosquito is that it increased the bite of the mosquito because they might need more energy to survive. So they bite more. So the more that the mosquito bite, the higher probability of virus transmission occur, right? It's not the same thing that you have 1 or 2 mosquitoes that are only biting 2 or 3 times per day. But with the increasing in temperature, they require more energy and more food, so they bite more. So you have one simple individual that is biting 15 to 20 times per day. So you are increasing the probability of transmission with the viruses.
Thanks for that. Yeah, I saw a good paper recently on this, that the increased temperatures accelerating and modeling that they will accelerate the transmission of arboviruses. From Christine Sotero-Harry about mitigation. What or which agencies in the Caribbean can we collaborate with that will help us to decrease or damage control the effects of increasing temperature?
Well, I think that James, you mentioned a couple of them. CARFA is one of them that might not be necessarily mitigating, but it can help by providing information, by providing techniques, tools, webinars, resources that might help the different islands and territories to mitigate this these hazards in the Caribbean. I'm not aware of all of them that might help us, but James, I don't know if you have more information.
Thanks, thanks, Pablo. Well, some of the meteorological offices are beginning to pay more attention to heat. This morning we were in the Met Office of Trinidad and Tobago, and they were explaining their new warning systems for heat. And the Caribbean Institute for Meteorology and Hydrology, which will be running the skills and practice session, the last session in this course on the tools, have early warning systems for heat. We just have a minute or so again. What is the relation between heat and air quality, and what's the impact on health?
Wow, another good question. It might change the ozone, the bad underground level ozone, for example, which is can create the smoke, and in some cases deteriorate even worse the air quality in urban areas, for example, right? So it might provoke or promote, sorry, chemical reactions with particles and gases that obviously it might create a hazardous conditions in some areas, okay? But it's not something that we can say that is a linear equation, right? But it might happen, yes. One of the best things that we have, at least in the Caribbean islands, is that we have the trade winds. So because of that, there is a lot of ventilation in the outdoors environment. But what happened in other cities and continental cities, for example, with the reaction of air surface temperature increasing and the air pollution, is that they don't have the necessarily ventilation as we have here to at least minimize that impact. It might occur, yes, absolutely, with the chemical parameters and the corresponding different gases and particles in the atmosphere. With the temperature, there are chemical reactions. It can change, yes.
Thank you, thank you. The last question, because we're at time now, but what advice would you give to pregnant women?
To maintain hydrated, to continue monitoring the weather situation or the weather conditions, following your weather agency or the corresponding agency in your country or island who is responsible of monitoring the weather, to avoid the hours in summertime, mainly the hours that are the worst for heat, for example. So between noon and 3 p.m. in the afternoon, for example, avoid that kind of exposure. Avoid doing exercise during those times as well. Maintain hydrated and follow your medical doctor suggestions.
Thank you, Pablo. Well, this brings us to the end of this evening on focusing on heat. It's like that song, how you feeling? Hot, hot, hot. It's certainly getting hotter in the Caribbean. It's not something I used to think about a lot, but I'm realizing more and more this is a significant issue for us as climate change advances and brings hotter and drier conditions to the region. Thanks everybody for joining us this evening. We are closing the session now. Please put your CME, respond to the CME questionnaire within 2 hours if you wish CMEs. And if you wish CMEs, we're now in a position to receive the payment. We will be sending the link for paying for CMEs, and the closing date for payment is May the 11th. The 11th of May will be the closing date for payment for the CME credits. Thank you very much, everyone. Look, a lot of comments in the chat that folks appreciated the session. We've had nearly 300 people here this evening. Thank you very much, Pablo, bringing us the situation in Puerto Rico, which has faced a lot of problems with not only Hurricane Maria, but also increased heat. Paula, you have a point to add?
I just want to say thank you for inviting me. I'm very happy to be here and sharing this information with all of you. For the audience, thank you for being here, for listening. I hope that you can use this information in your territories, and I'm here to help. So whatever kind of information that I can provide, please send me an email, and I will be happy to get in contact with you.
Thank you, Pablo. Well, we need to work together. Necesitamos trabajar en conjunto, ¿no?
Sí.
Okay, bye-bye, everybody. Good night. Have a good evening.
Bye, good night.
Gracias. Ciao, Paula, and everybody. Thank you.
Bye, thank you.